So the color of the tongue is it pale? This goes back to what we talked on that previous slide. It's either cold or blood deficiency. And so you have to ask the questions, right? You have to ask questions to say, well, is this really cold or is this really blood deficiency? Do you have other blood deficiency symptoms? Do you have blurry vision? Do you have dry, pale skin? Because blood will nourish the skin. Right? There's other ones. Sure. Muscle cramping, hair feeling dry or falling out. So the falling out is more kidney than blood. The quality of the hair is more liver blood. Or is it red? This tells you whether that it's heat, no matter what. But is it an excess heat or deficiency? You have to look at other things. Or if it's purple, it's a blood stagnation. Like there'll be literally a purple color to the tongue. There's another one that I didn't put here. It's called dusky, which is like just a twinge of purple, just a little bit. When you have that twinge of purple, what it is referring to is a liver qi stagnation. The liver qi isn't moving the blood well, so the blood is getting stagnant a little bit. Same thing with those small dime-sized clots that we were talking about. That's more liver qi stagnation, not moving the blood, versus full-on blood stasis will be bigger clots, or in this case, a more purple tongue. You can also look at the underside of the tongue, the vein under the tongue. How distended are those veins? How purple are those veins? Those can be used diagnostically. Which, by the way, I didn't mention this in acupuncture, the acupuncture class. You can actually needle those 2 points under the tongue, needle right into that vein. But you'd only do it, you'd only do it for someone who had a stroke, right? They had a stroke, their tongue's deviated to the side, they can't talk. And you do that and you're increasing the blood flow to that area. Getting out the old blood that's not moving and bringing in new blood.
How do you make sure that they don't?
You grab their tongue with gauze and you have to wear gloves for this. Grab their tongue with gauze and put gauze around your hand, for instance, so that if they do bite down a little bit, you have cushion. And you just needle it really quick and done. But you gotta get it to bleed. Just get it to bleed and then you're done. Yeah.
And how long, I mean, for something like that, how long would you keep it on? Do you need like
you needle it and then take the needle out.
Oh,
yeah, they can't sit there.
Just to get the
just to get the bleed.
That's what I was thinking.
Yes. Yeah. I've never actually done that. I would though. I have patients to do points that they wouldn't normally do. The reason is because I like to explain to them, I'm like, okay, I know this point's not going to be so great, but if you can do it, it will be so much more beneficial for you. I almost always can get a stroke patient to do 26, this one right below the nose on the philtrum. It hurts so much. And I sit there and do this technique called bird pecking, which we didn't talk about either, but you're sitting there with a needle and you're pecking it into that point, like a bird pecks at seeds. You're pecking at it, and you do it until they cry a little bit. They have to shed some tears. And I'm like, I'm so sorry. And like, I know this is not great, but you know this is good for you. Do you want to do this? Okay, okay. And every time they're like, okay, well, are we doing that point? Right? Because they understand why. They understand the benefit of it. And so you do that. By doing that, it's called opening the orifices. You're opening the consciousness of the brain and all of the different channels in the face. And it's really good for stroke or Bell's palsy.